Let me introduce myself. My name is Harry Dougherty Jr. I'm in private practice 4 days a week in Sherman Oaks, California. I also teach at the University of Southern California and I'm an adjunct professor teaching cephalometrics, diagnosis, and treatment planning. The patient presents as a 40-year-old female in good health with a non-contributory medical history. Her chief concern is her crowding and anterior crossbite. She is in upper management in her company and feels that her poor smile is hindering her ability to progress in business. She has mild beginning recession on teeth numbers 2, 3, 4, 5, 12, 13, and 21. While most of her periodontal probings are within normal limits, she has subprobings in the posterior quadrant in the 4 mm range. She has a root canal on number 3 and crowns in all 4 posterior quadrants. Her profile shows a convex class 3 profile with mild double protrusion. Her lips are slightly apart at rest. Her upper lip is on the E line, while the lower protrudes 3 mm in front of it. The molar and cuspid are mildly class 3, the right molar being 1.5 mm and the left molar 3 mm. There is minor crowding of 4 mm in the lower anteriors and a mild curve of SPE at 1.5 mm. There is also minor crowding in the upper arch of approximately 3 mm. The gingival margins of the upper anteriors are uneven. The upper and lower midlines are on to face, but the lower incisors are leaning to the left side slightly. The panoramic radiograph shows generalized horizontal bone loss of about 2 mm. The lower third molars are present. The lower incisors are upright at 88 degrees and the upper incisors are ideal at 104 degrees to the SN line. The A and B is 3 degrees and width is 1 mm. The mandibular plane angle is 31 degrees, which is average, but on inspection her mandibular angle appears to be more vertical. Her occlusal plane is flat at 10 degrees. While A and B and widths look to be in the class 1 range, she appears to be more of a class 3 vertical pattern. If we evaluate this patient from soft tissue cephalometrics, our net analysis, we see a slightly steep occlusal plane at 93 degrees, lower incisors upright at 65 degrees, and the upper incisors slightly detorqued at 64 degrees. Treatment objectives. The goal of treatment is to improve the smile and even the incisal display, at the same time correcting to ideal overbite and overjet and correcting the cuspids and molars to class 1, so there is ideal function, anterior guidance, and cuspid rise. The lips are apart at rest and the patient is able to swallow without lip strain. Maintenance or improvement of facial balance is desired. The patient refused traditional labial appliances, though she would accept aligner therapy or lingual appliances. We considered 5 options of treatment for this patient. The first option we looked at was lower first and upper second bicuspid extraction. This will allow for reduction of the bimaxillary protrusion and correction of the class 3. Very difficult to do with aligners because bodily movement is needed. Lingual appliances would be a choice here. The second option would be upper and lower second bicuspid extractions. Again, very difficult to do with aligners due to large bodily movements. Lingual appliances would be the choice here. The third option would be to extract a lower incisor with upper IPR. This could work nicely with aligners as well as lingual appliances and improve overbite and overjet. The fourth option is with upper and lower IPR. Significant IPR would be needed to create arch length, as Class 3 elastics would be needed to align the teeth and correct the bite. Both aligners and lingual appliances could be used here. The fifth option involved lower arch retraction with mini screws and upper IPR as needed. Both aligners and lingual appliances could be used here, but lower torque control would be challenging, as well as bodily distization of the whole lower arch. Lingual appliances would be the better choice here, but aligners could also be a choice. If you're interested in seeing how this case is treated, please look at the PCSO journal, Spring Edition 2018.